I come from the Occupational Health Clinics for Ontario Workers. We're a building that's behind Devonshire Mall, and we're a multidisciplinary clinic. We have an occupational physician, me, 2 occupational health nurses, Ivan Bauer, Faye Lawn, they're both here today. We have 2 ergonomists, and we have an occupational hygienist. What we do is we do a lot of worksite visits. We do prevention strategies, and really that's what we'd like to do, is really prevent a lot of the occupational diseases from occurring. We do medical surveillance. We do assessment. Workers come in and say, I've got this illness, and they're concerned with respect to the relationship to their workplace exposures, and so we assess whether or not it is work-related. We do research and education. What is asbestos? Asbestos is naturally occurring, and it is mined from the earth. There's a large asbestos mine in Quebec, in Asbestos, Quebec. Canada at one point in time was a major exporter of asbestos. Asbestos used to be utilized as an insulation because it's fireproof. And so it was incorporated into many different types of equipment and housing, buildings, all sorts of things, and ships. There's really 2 types of asbestos present. One is called amphiboles, and they're needle-like in shape. And there's something called serpentine, and just like the name, they're like serpent type of wave type of features with it. Next. This is a picture at the top which shows you the fibrous nature of the asbestos, and this is some crushed asbestos. There are 3 major types that are utilized. One is called chrysotile, amosite, and croxidolite. This is a picture of chrysotile, and this is one which is most commonly used, and it's mined in Canada, and it's called the white asbestos, and it's produced in asbestos cloths and for cement products. The next is something called amosite, and it's the brown asbestos, and it tends to be more straight, brittle fibers. It's mined in South Africa, and it tended to be used a lot in insulation and pipe lagging. Croxidolite is a blue asbestos, straight fibers, very high temperature resistant, and really it's a croxidolite which is really the major concern, and it tends not to be utilized in Canada. This again gives you pictures of the fibrous nature of it. And also, this is a picture of the needle nature of it, and it's because of the needle quality that it produces problems. This gives you an idea that the large circle is a human hair. The little pinpoint at the very side of it is the size of the asbestos fibril. So they're very minute fibers. Because they are minute, and depending on the length, depends on where it is distributed in the body. The characteristics of the asbestos, as I mentioned, they're normally occurring. There's no odor or taste, so you can't be aware that it's there. They don't dissolve in water, nor do they dissolve in body tissues. They're very resistant to heat and fire, and that's why they were utilized. And some people who are proponents of asbestos are saying because of taking it out of the ships, that with the war in the Argentine area, there was actually more people killed because of the asbestos was not utilized because of the fires aboard the ships. They're not broken down. When asbestos becomes a problem, it's because it becomes friable. When it's in its non-friable state, there's no problems with asbestos. So if it's wrapped, such as insulation, there's really no problems with it. It's when it starts to break down and becomes friable that's when people start breathing in the asbestos. As I mentioned, it's also woven into the textile industry, and there was a large textile industry at one point in time utilizing the asbestos. There used to be asbestos blankets, and I hear firefighters used to utilize the asbestos blankets quite frequently previously. It was used as a fire retardant, thermal lagging, fire blankets, welding blankets, backing to sheet vinyl floor covering, and flexible connections. In the elevator shafts, it used to be sprayed on the elevator shafts so that because there's a lot of friction and heat, that older buildings with elevator shafts have a lot of asbestos in it. Also with brakes and clutch lining, Bendix was a plant here locally that utilized asbestos in the brake shoe industry. Next. When is it a hazard? It's a hazard when it becomes friable and exposed. And it's in that state that you have to have a concern. So anytime you're doing the explosions, you are making friable asbestos. The characteristics of when it becomes a problem. Our body is very efficient at getting rid of a lot of things that we breathe in. Larger particles that we breathe in are automatically cleared from the nose and the sinuses, and that's the function. Our nose and sinuses produce mucus, and that mucus is there to trap dust particles, bacteria that we breathe in. And the mucus is cleared from the nose and the sinuses, and we normally spit it out, we swallow, we get rid of it that way. The upper airway in the lung does the very same thing. So larger particles tend to be cleared. It's the smaller particles that we breathe in that go all the way to the air sacs and are of concern. So it's the smaller particles. And so those which are less than 3 microns in diameter, which are very small, longer than 5 microns, and the length to diameter ratio of 3 to 1 are the fibers which are a concern. And how are people exposed? It really depends on how much exposure people have. So those workers that used to work in asbestos production, the asbestos miners who did not wear any face protection, those who used to be the insulators for the pipes, they would take the asbestos powder and they'd add water to it and then they'd put it on the pipes. So the more exposure to the asbestos, the greater the risk was. Anytime you disturb asbestos in demolition, remodeling, removal of insulation, break repair, there is some exposure. All of us are exposed just naturally because asbestos is in the earth. We're normally exposed to some fibers during our lifetime. The occupational exposure is really the significant exposure, but there is some bystander exposure. We know that spouses that used to wash the clothing of workers, insulation workers, they as well came down with lung diseases related to asbestos exposures, in particular that of mesothelioma. The next is the examples of some of the asbestos use, and really it's used everywhere. Any place that you want to have a fire retardant, that's where asbestos was utilized. So in the older homes, you're going to have asbestos. And as I mentioned, that any time that you've got any damage occurring, that's when the exposure tends to occur. So this just goes through all the different areas, potentially in a home environment, shingles, all the way down to the basement where it is utilized. This gives an example of some of the types of shingles that used to use asbestos. Next. This again gives you some indication of where asbestos is utilized. Even the fencing at one point in time had asbestos involved in it. This is the student carols, and most of you don't seem old enough who probably don't even remember those carols in the school where we used to sit, and when you're really bored you were marking it up. They contained asbestos. So even during our student years, some of us were exposed to some amount of asbestos. This person looked like they were actually chewing it, that they're so bored. The vinyl flooring, as you walk on it and you chip parts of away, asbestos is being exposed. Again, insulation, especially if you go into some of the older homes, the white insulation, you can see that some of it's built, made of asbestos. And your health. Why and what are we concerned about? We talked about the fiber size and the fiber type. And the different types of asbestos have different degrees of harm, potentially. The length of the exposure, so the person who has 1 day of exposure versus somebody who has worked there for 8 hours, 10 hours, 12 hours a day for 40 years, their exposure is definitely different. The longer you work in asbestos, the more the risk is. The other is a concentration of the respirable fibers. So the smaller fibers that you're exposed to, the greater the risk. And again, there's also the individual susceptibility. It's like swimming in a shark pond. Not everybody is going to be attacked by the shark, but some people are at greater risk if they have cuts, whatever, than other people. So your risk is variable. And there's influence of many other type of factors which we don't know. Genetic is one of them. The other is smoking. If you're a smoker, your risk of developing asbestos-related cancer is 40 times that of a non-smoker. So smoking definitely is a significant factor. This again, how does it enter the body? We already talked about breathing it in, but also ingestion, because some of that saliva is going into the esophagus, into the stomach, into the bowel, and there's also effect with that. And because they're needle-like fibers, those needles go into the tissues and they stick in the tissues. And the concern is, especially with respect to the lungs, is because of the size of them, it migrates all the way out to the lining of the lung. And that is where a lot of the changes occur when we look at chest x-ray. So it's the migration that goes all the way out to the pleura. And what the pleura is a very fine lining. There's two of them. There's one which lines the lung. There's another one that lines the chest wall. And anybody who's ever had spare ribs, that fine membrane which is on the side of the ribs is called the pleura. And that is the same as what's in the human body. Those fibers go and they stick in the pleura and they cause a reaction. And that reaction is an inflammatory reaction. So you get a little bit of inflammation there, and over years and years and years you get thickening of the lining of the lung. So it produces pleural thickening. Next. Next one. As I mentioned, asbestos fibers do not break down, but the body tries to protect itself. And it's got little cells called pac-men of the lung. They're called the macrophages, and they come and they gobble up the asbestos fiber and they wall it off. And what happens over periods of time, and it's that brown hair-like structure that you see in the upper part of the slide, is that iron is deposited on that fiber, and so it becomes brown in coloration. It's called a ferruginous body, and that stays in the lung forever. So the body can't break it down, and that is why it's a major concern, because the asbestos fibers stay there. The major problems with asbestos are related to the lung. One is, and we're going to go through some of them, asbestos-related pleural disease, and we talked about the pleural reaction. Mesothelioma, which is actually which is a cancer of the lining of the lung. Lung cancer and asbestosis. It's also associated with elevated risks of other types of cancers, such as laryngeal or voice box cancers and bowel cancers. What happens in the lining of the lung? One is that you can develop a little bit of fluid, and that fluid tends to come, we see it on the x-ray, and it goes away. And that's just an inflammatory reaction. The pleural lining normally produces fluid. And what happens is when we take a deep breath in and out, what it's there for, it reduces friction, so you can easily breathe in and out. It can produce more fluid, and that's what we call a pleural effusion. That is relatively benign. It tends to occur after about 10 years of exposure. It's self-limiting and it resolves. And nice thing about lungs, you've got two of them, so on a chest x-ray, you can always compare one side to the other. If you remember, lungs contain air, and therefore on a chest x-ray they're going to be black. And so black is okay on the x-rays. Black on an autopsy in the lungs is not good, but on the chest x-rays we allow it. The heart is solid, so therefore the heart is white. So if you look at this chest x-ray, this is the right side and this is the left side. On the right hand side you see a normal lung. You also see the blood vessels coming out from the heart into the lungs, and that's what that white line is there. Over here, obviously it's different than the other side. You've got the heart shadow, but there's also this white blob that shouldn't be there, and that's the fluid. The next one. The pleural thickening occurs. And again, that tends to take many years to develop, 20 to 40 years. And all we see on the chest x-ray is some thickening at the sides of the lung. Totally benign. Over periods of time, calcium is deposited on them, and it produces little white plaques on the chest x-ray. Again, benign. Unless you have very extensive pleural thickening, at that time the lung becomes restricted. But normally it's just an indicator of asbestos exposure. And here at the bottom we can see a little white line on the diaphragm, and that is the calcium that's been deposited there. So pleural plaques tend to take about 20 to 40 years. Next. Don't go back. Okay, we saw the calcification. Next. Asbestosis, again a latency period. And what asbestosis is scarring in the lung. The asbestos fiber produces an inflammatory reaction, and it produces scarring, which is fibrosis. The scarring tends to be at the bottom parts of the lung. And what happens is it is related to the amount of exposure that you've had. So the more work with asbestos, the more likely you're going to develop the asbestosis. The other is that once you are out of the exposure, you can still get some minor changes, but it tends to be, this chest x-ray shows the scarring, all this additional white on both sides of the lung. Next. This again shows the inflammatory reaction in the lung with it, and it produces scarring. The amount of the asbestosis depends on the amount of symptoms that people have, but it can be very disabling, and it can also be fatal. This is just an interesting thing that happens with asbestos exposure. Because of the inflammation, lung gets trapped into the pleura, and we see these little rounded little balls in the chest x-rays. The other is it's associated with lung cancer and mesothelioma. And there's a picture of a lung cancer on the other side. Next. The lung cancer, there's an increased risk of the development of lung cancer with asbestos exposure, but the major problem is if you're a smoker and asbestos exposure, it increases the risk at least 40 times. So, in essence, I'm again a proponent of not smoking, period. Next. Mesothelioma is a very rare cancer. It occurs in the lining of the lung. It is definitely asbestos related. And the problem with the mesothelioma, it is not necessarily associated with amount of asbestos exposure. The problem with it is that because of the needle shape, those needle fibers go to the lining and it produces the inflammation, and occasionally it can produce cancer. And it tends to be a very fatal cancer. It's a very rare cancer. And this is just a picture of the lining of the lung at autopsy, and that whole lung is encapsulated by tumor from the mesothelioma. Okay, I'm not going to go through this. How do we identify asbestos fibers? Really, you need an electron microscope to look at it to tell about the fiber. So when you take samples, the samples go off to special labs where they identify what type of fiber it is. Next. There are specific exposure limits set by the government as to how many you're supposed to have, but really, there's no safe level for asbestos. What you want to do is to limit your asbestos exposure as much as possible, and I would strongly urge you, if you're going to go in and do your practice demolition, that you should be wearing appropriate masks. I mean, not only are you being exposed potentially to asbestos, but you're also being exposed to a lot of dust particles, and the other is, I mean, you never know what molds are growing behind some of these walls. And you really don't want to disturb the asbestos unless it's done appropriately. And there's appropriate mechanisms for removal of asbestos. Housekeeping. In your fire halls in the police department, go around, look for, especially if it's an older building, make sure that it's well maintained and get things changed if it isn't. Next. Next one. Relative risk. I've told you all the nasty things which happen with asbestos. We are using much less asbestos now in Canada than we did before. We are shipping asbestos out to third world countries. We still are a major exporter. So the concern is that we've actually shipped our problem to other countries. But in Canada, the occupational exposure is very limited now, other than, again, we still have some asbestos miners. There is still some asbestos utilized. The asbestos industry in Canada is trying to find innovative ways of still utilizing asbestos and maintaining the industry. They are trying to develop asbestos paper, and the concern there is if you're shredding paper, you may get some exposure there. But generally, the occupational exposure to asbestos is very limited. The other is that when asbestos is identified, the workers who go in to do the removal are well educated, and they should be doing it appropriately. So there's back. Occupational exposures today are about 1,000 times lower than in the past. The background rates for mesothelioma. For the general population with minimal exposure, and I would still rate your exposure as minimal, are about 1 to 2 cases per 1 million people. So it's still a very small risk. It's there, but it's a very small risk. Background rates for lung cancer and asbestos, minimal asbestos exposure, are still mostly related to the smoking. Very minor increase with minimal exposure, but it's still the smoking which is the major problem. Next. This comes from the Environmental Protective Agency in the U.S. to give you a comparable idea. So if you are working in a building that has some asbestos tiles and asbestos exposure, and schools in particular have always been a concern, that what is your risk after working there for 10 years? It's the equivalent risk of riding a motor vehicle for 1,000 miles. Hey, depending on where you're riding, the risk is fairly minimal. We take that risk as an acceptable risk. Smoking in a lifetime, about 5 cigarettes. That's what the risk is equivalent to. So most of us in our teenage years, when we tried doing things, I'm sure most of us had tried equivalent of 5 cigarettes. We didn't think that was very risky. Living with a smoker, well, for a period of 7 months. There is a risk if you're living with a smoker long term. Your risks for cancer, lung cancer, are elevated. But we accept that as an acceptable risk in our society. If we live in a building in a brick, if we live in a brick building for about 7 months from the background radiation from the radon daughters that normally come through buildings, we consider that an acceptable risk. Next. So in essence, if we look at that person who is working in that school building, they would have to be in that building for the equivalent of 40,000 years before the risk is appreciably elevated. So this is trying to give you some idea of what the relative risks are. You are likely exposed to a little bit more than that because you're in the demolition of the building, the fibers are being broken down. But still, the relative risk is still considered to be minimum. Is it no risk? It definitely is not a no risk. Because the concern is that every exposure to an asbestos fiber, there is a potential risk with it. For some of the diseases, it's an accumulative risk. So for asbestosis, the longer you worked there, the more, if you work there every day with high exposures, your risk of developing asbestosis was increased. Did every insulation worker develop asbestosis? No. Some have. Not everybody. So your risk, there is some risk, but you know, especially in the police force and firefighters, you're exposed to risk every day. And some of it is acceptable risk and some is not acceptable risk. And so what we want is for you to, in future, reduce your risk as much as possible. Next slide. So it's important to wear the protective gear. So if you're going to go in and do the demolition practice, I would definitely wear an acceptable mask. Next. Medical surveillance, and I'm just going to give you a little bit idea of what your options are at this point in time. All of the disease states are diseases which occur in 20, 30, 40 years down the road. So is there any reason to panic? No, there's no reason to panic. Is it reasonable maybe to get a chest x-ray and breathing test as a baseline? Maybe for your own sense of well-being, it's worthwhile to get. You're also at increased risk for other problems with the lungs just because of the exposures that you have on a daily basis. So it might be reasonable to do. But is it reasonable to have chest x-rays and breathing tests on a regular basis for the asbestos component of it? No. Because we're looking at something that's going to maybe happen 20 years, 30 years down the road. In most cases, if you have the pleural thickening, it's benign and does not affect your lung function at all. So I just leave it open to you that it might be reasonable to get a baseline breathing test and chest x-ray. The other is any time that we do medical surveillance program, the records are kept confidential, and by law we have to maintain them for 40 years. And why the 40 years? Because it takes 40 years to get a lot of the problems in the lungs with the asbestos.